This week, we've told you how COVID-19 has impacted the ongoing opioid epidemic and put a strain on resources like never before. Tonight, our Danae Bucci has more on what's happening at the state and local levels to work through these challenges.
It's something that we've definitely seen increase. It's something that we're concerned about and something that we are prepared to engage in and are currently engaging in.
For years, the Georgia State Opioid Response Team has taken a targeted approach to the epidemic.
So what we have is a multi-pronged, multifaceted approach to educating the public and first responders.
And state legislators have been meeting to make some of those prevention tactics law.
I'm chair of Health and Human Services, and I'm on appropriations.
Savannah State Senator Ben Watson is also a primary care doctor at South Coast Health.
What we did was we required all physicians to check on a prescription drug monitoring program, whether you're in the emergency room or here in my office.
This monitors all drug and narcotics going to a single patient. Watson is also one of 5 senators who have introduced a bill to expand drug abuse treatments and education programs.
The pendulum went way too far, and there were way too many prescriptions done. We've reined that back in.
Cities across the U.S. have also been trying to get ahead of the issue while legislatures work. The Savannah Police Department unveiled their behavioral health unit in September of 2020.
Part of that was to utilize the grant to do a more focused approach on getting help for people with opioid abuse.
My name's Anthony and I got my clinician with me, okay? So you said that none of these guys are here to help you, but we actually brought a social worker out here.
The unit responds to mental health calls, including those suffering from addiction.
You're not going here, okay? That's not what we're here for.
At the time, there was no option but the jail. People would go to jail for crimes associated with substance abuse or mental health.
Put your hands down, huh?
Hands down.
Put your hands down.
You can think of Savannah's behavioral health unit as one big puzzle, comprised of many things. There's some more predictable things like officer compliance or having the recovery centers to send people to, and some more difficult ones like community buy-in. And if there's a disconnect between any of these things, the BHU can't perform as successfully as it was designed.
We have developed multiple trainings from the State Opioid Adapted Response, which is a crisis de-escalation training with first responders and law enforcement when they're called on scene. We have naloxone training for first responders. So we not only train every single county in Narcan usage, but we equip them with Narcan too, to reverse overdoses.
And he's hoping those same resources can be replicated with the general public.
It's definitely very important to take out judgment and help combat the stigma by letting people be aware that it's more about a health issue, not necessarily a judgment issue.
And that was Danae Bucci reporting. Georgia has a Good Samaritan's law, so if you come across someone who needs help because of drug abuse, you can call 911 without being held liable.